Allegiance Health is taking a proactive approach to Ebola preparedness. We are working with local, state, and federal public health officials to implement their recommendations to screen our patients in order to determine if they are at risk of being exposed to the Ebola virus, which is currently an epidemic in West Africa. This video provides an overview of the updated travel history algorithm. It explains how to properly screen patients at all points of entry, what should staff do if a patient answers yes to all of the questions, and the overall organizational response, which occurs when a call is made to the emergency department. Updated travel algorithm. The international response to the Ebola epidemic in West Africa is an ever-evolving situation, which causes the recommendations from our local, state, and federal public health officials to change from time to time. Because of these changes, Allegiance Health has updated our travel history algorithm. The first change is the addition of Mali to the countries in West Africa where the outbreak continues. The second change is a revised step if a patient answers yes to having traveled to one of the 4 countries listed but is not symptomatic. In the revised process, staff are to instruct the patient to contact the local health department and educate the patient on the signs and symptoms of Ebola. Also, it is important to call the emergency department and ask them to contact the health department. Patients can continue with their appointment or procedure if they answer yes to the travel history but are not symptomatic. The Center for Disease Control and Prevention, in conjunction with the Michigan Department of Community Health, are working to monitor individuals who travel into the United States from one of the 4 countries listed in the travel history algorithm. Please be sure you are using the updated travel history algorithm dated December 1st, 2014 when screening patients. If you have an older version, please ask your manager for an updated algorithm. Please discard the older version. How to properly screen patients for travel history in the hospital. All points of entry have been instructed to screen patients for travel history since late October 2014. Points of entry for Allegiance Health patients include, but not limited to, the emergency department, imaging, laboratory, labor and delivery, physician practices, and behavioral health. It is important for staff at all points of entry to use the updated travel history algorithm to ensure every patient is screened and screened properly 100% of the time. Let's watch a scenario to see how the screening occurs at one of the points of entry.
Good morning, welcome to Allegiance Health. How may I help you?
I need to be seen. I don't feel very well.
All right. I'm sorry to hear you don't feel well. Before I register you into our system, I'm just going to have a few questions for you. Have you traveled to West Africa, including Guinea, Sierra Leone, Mali, or Liberia in the past 30 days? Or have you been in contact with someone who has traveled there?
Yes, I got back from Liberia 5 days ago.
Do you feel like you have a sudden fever, a severe headache, joint and muscle pain, weakness and fatigue, vomiting, diarrhea, and abdominal pain, or unexpected hemorrhage?
Yes, I feel hot, I have a headache, and I've been vomiting uncontrollably.
Thank you for that information. You will be seen as quick as possible. For the protection of our other patients and our staff, please take that mask and place it around your mouth and your ears. Now I need to ask you to please walk over to the side of the waiting room. Thank you.
Emergency Department, this is Rachel. How may I help you?
Hello, this is Marcy from Triage. We have a patient who answered yes to all of the questions from the EVD travel history algorithm.
Have you placed a mask on the patient and isolated them from others?
Yes, the mask is on and he is isolated.
Did anyone else come in with the patient?
No.
Please stay on the phone with me and we will send a staff member to get to the patient. Sir, come back with you.
As the emergency department staff member is walking the patient to the patient care room, the ED clinical unit leader is paging the Ebola core preparedness team to notify them that a patient suspected of having Ebola is in the emergency department. This paging group includes the emergency department director, infection prevention, the administrator on call, the house ship supervisor, and the safety department. The Safety Department, working closely with the ED CUL and the administrator on call, will activate the Ebola Response Taskforce, the Hospital Command Center, and notify our local public health department. The Ebola Response Taskforce is a group of staff from the emergency department, critical care units, and labor and delivery who have volunteered to care for a suspected Ebola patient. This task force will continue to receive additional training on how to properly care for an Ebola patient. How to properly screen patients for travel history at an offsite. Let's take a moment to watch a scenario of how the Ebola screening would occur at an Allegiance Health facility other than the hospital.
All right, good afternoon. Welcome to Allegiance Health. How may I help you today?
I'm here for my procedure.
Before we begin our registration process in our system, there's a few questions I have to ask you. Have you traveled in the last month to West Africa, including Guinea, Liberia, Mali, Sierra Leone? Or have you come in contact with anybody that has traveled to West Africa that might be ill?
No.
Okay, now we can begin our registration process for your procedure. Thank you.
If the patient had answered yes to all of the screening questions and exhibited Ebola symptoms, the staff member would have followed the same steps as seen in the previous scenario, including placing a mask on the patient and calling the emergency department. The emergency department clinical unit leader would have taken an additional step to call 911 to request an ambulance to be dispatched to the caller's location. The same internal notifications and activations would then occur to protect other patients, visitors, and staff. Pre-registration. When patients are pre-registered for a procedure or a test over the phone prior to arriving at an Allegiance Health facility, they will be asked the same Ebola screening questions. Even though the patient may have asked these questions during the pre-registration process or during a previous visit, it's still important to ask these questions again each time they arrive at an Allegiance Health facility. Thank you for watching this video. We appreciate your continued support to ensure we are using the most current Ebola travel history algorithm at all points of entry, every time, with every patient. Please ensure the updated algorithm can be easily seen in your work area. If you have any questions or comments relating to this video or the Ebola screening process, please contact the Safety and Emergency Management Department. Thank you.